Hi, everyone, and welcome to Let's Just Do This. It's Margaret Wallis-Duffy and
Todd Miller.
And we are thrilled to be here with you once again to bring topics to the table to help educate, empower, and inspire you to live well. Now, this gentleman across from me has been on our show before, and we're thrilled to have him back, along with his colleague, Denise Roy. Dr. George Grant, I gotta tell you, I've learned so much from this man. He is a world-renowned and well-respected doctor. Let me give you a bit of background about who he is, and then we'll get started on our discussion today. So Dr. Grant is a professor, has a PhD from the University of Toronto. He's referred to as the caring doctor. He is considered the Canadian authority in integrative medicine and functional medicine, and is known as Canada's wellness ambassador, my kind of guy. Dr. Grant is an award best-selling celebrity author of 10 books, 5 patents, 250 published papers, 375 paper reviews, hundreds of conference presentation, and he's also been the senior consultant at Health Canada and has done work and research with Harvard and the likes of Johns Hopkins, the Mayo Clinic, Cleveland Clinic. If that doesn't impress you, I don't know what will. And next to him, an incredible woman named Denise Roy, who is the VP of the Academy of Wellness, but most importantly is here from passion because Denise was actually a patient of Dr. Grant's, and her health was completely turned around because of his work, and now you are linking arms with him to get the word out to help educate others so that we can all live healthier. And today, Todd and I are excited because we want to just pull from that brain of yours and that experience some top tips for a few things that most of us suffer with. Okay. So we're just going to do a highlight. Let's tell the listeners and viewers some of the top things we're going to discuss, and then we're going to delve right in.
We are going to look at pain, and I don't know if anyone suffers from pain. I'm sure a lot of us do. We're going to look at hypertension, otherwise known as blood pressure, which affects me. Okay. We're going to look at autoimmune diseases such as fibromyalgia, MS. We want to touch upon mental health, which is affecting a growing segment of the population, and fertility.
Yes.
Hello.
Which is certainly something that impacted my world and yours as well.
Yeah.
So let's dive in because we really want to stock people's toolboxes with practical strategies, but we want them to be evidence-informed.
Yes.
And of course, that's what you can do. So let's start with the topic of pain. And this is a broad topic, and I know we could do an entire series, and we're going to. We're going to do a full documentary series on an integrative approach to pain. But let's get started with some tips so viewers at home can really start to tackle this.
Okay, so on those 5 topics, I need 1 hour each, so I need 5 hours.
Yes, exactly, yes.
Let's order in.
But instead of doing this, I'm going to do it in 5 minutes. So I'm going to speak fast. If your viewers thought I speak fast, it's not true. They're listening slow. So I want them to increase that volume a little bit.
Or let's even just give a little bit, and then we can bring you back, because I want everyone to digest the goodness that you're about to share.
So the good news, Margaret, is I have 375 blogs on my website to address these 5 topics. So if they miss any words or any publications, they can go on academyofwellness.com, look at the blog corresponding to this.
Awesome.
For pain, we do not need opiates. We do not need opioids. That is actually very addictive and it's very dangerous. Yes. We do not need NSAID, non-steroid anti-inflammatory drugs. Anything like acetaminophen, which affect the liver, Advil, affect the heart. This is all published, evidence-based science. Aspirin, I work with the top doctors, cardiologists in the world, Dr. John Foltz, who did work on aspirin for 28 years. And he said, aspirin can cause gastric bleeding. This is from the horse's mouth of the top cardiologist. Sometimes aspirin is recommended for people with arthritis at 250 milligrams, or people who have blood pressure at 81 milligrams, it's called baby aspirin. But you have to be aware of the side effect. So for every medication, there is risk and there's benefits.
Right.
So there's pharmacology and there's toxicology. So you have to balance that. So very important when you have pain, you do not look for over-the-counter, because people have the idea that over-the-counter is safe. It is not.
Right.
In fact, if you don't believe me, go ahead and try 10 or 20 aspirin. No, I'm just joking. Don't do this because you're going to have gastric bleeding. Because do not overdose on those medications. That's number 1. Number 2, to reduce pain, is all you got to do is just learn how to do the belly breathing. Because the belly breathing reduces the pain by almost like 10% from here, not from here. So it's very important to learn this. And for pain, you can use things like turmeric, curcumin, which you spoke about it there in the first segment, It's actually natural pain relief. Ginger reduces pain. If somebody have migraines, they do not have to take any of this NSAID. All they have to do is just do the massage in their temple here, occipital in the back here, and do things called EFT tapping. The tapping is simple things that can reduce pain better than any other opioids that I've studied, I've taught, and there's no addiction for this. If you get addicted to tapping in your body,
It's a good
that's
thing.
actually a good thing.
We
actually a good thing,
we
yeah.
actually did an entire show.
Yeah,
that's a
EFT
tapping.
I work with Dr. Joseph Marcola in Chicago, and he always recommends this for 25 years.
Yes.
So this is one thing for pain. We work with fibromyalgia pain. Now, for fibromyalgia with autoimmune, they put them on antidepressants. Now, FMS is not a disease that they need amitriptyline and Prozac and Xanax. They're not depressed. It's an autoimmune. The autoimmune is basically contributed by something called thymus. It's the organ that is so important to produce T lymphocytes. So I tell them, you massage this area right here, and then they do the belly breathing, and they do the tapping on the thymus. And they come to me and said, I do not need amitriptyline, I do not need Prozac or Xanax or any of the stuff that I was taking. We've seen this with so many clients, and I work with the top physiatrists in the country, and we have seen people with MS, with fibromyalgia, with lupus erythematosus, recover from this within 3 months, with no medications whatsoever.
Right.
And we have seen people in St. Lucia who have recovered from these diseases. We have people coming on a crutch, and she left after the 1 hour without any cane or anything that required any medications whatsoever. And Denise have seen that herself.
Yes, absolutely, because I suffered of chronic pain for so long, and it only took a matter of weeks just by following his advice for me to be relieved of chronic pain most of the time.
Yes.
Because I have nerve damage, so the nerves are regenerating, so I still have a little bit of pain, but it's nothing compared to what I used to go through,
But
you
now
know?
you're equipped with tools and strategies to deal with
Strategies.
it.
Absolutely.
Exactly.
And also about, autoimmune, we have a very close colleague, Dr. Van Huven, who actually did years of research because he suffered of autoimmune disease himself since he was a child. And what he discovered is that it is all related to the gut.
Yes.
That was his main recovery. So we've been educating people a lot about looking at what's happening in the gut. It's your other brain.
It is indeed.
Right? So,
Yes.
well,
Yes,
autoimmune,
it is.
his discovery was every autoimmune disease has a straight, direct link to what's happening in your gut. Heal your gut, you're going to help your body recover, or at least, lower the impact of autoimmune.
Well, that is a great segue we can't not talk about the gut biome.
Well, the microbiome is so important. This
It's
is a whole
so-
science called functional medicine.
Yes.
And there's so much work now at the Cleveland Integrative Medical Center on gut microbiome.
Yes.
Because there's more serotonin and more dopamine produced in the gut than in the brain.
Absolutely.
So this is really the second or the most important.
That's huge.
It's
huge.
It's huge. So if somebody taking medication for depression, they have to look at the microbiome. They have to look at the prebiotics and the probiotics. And this is so important for the gut. Because if they have some problem with the gut, they're going to have a problem with the
Let
brain.
me just interrupt you. So
Absolutely.
you're saying by looking after the gut, it's
Yeah.
going to make your antidepressants work better.
You're not going to need. You're not going to need.
I didn't want to go there, but that's what I'm
It's a
hearing.
good point.
Serotonin
Yes.
is actually produced in the gut.
In the gut.
Yes.
And when our gut is not functioning properly, and I can certainly, I had shared with you, Dr. Grant, and
Yes.
I will share with those,
Yes.
our viewers.
Yes.
I had C. difficile and almost died
Oh my God.
and ended up having a fecal transplant. And the fecal transplant, which was completely natural, speaks exactly to this, which was reinstilling good bacteria,
bacteria.
into my gut.
Exactly.
I will tell you, not only did I have tremendous pain and lost weight and was very unwell when I had a hospital-borne infection, but the depression was evident.
Absolutely.
And when I had my son at 12 years of age donate his stool, but Dr. Thomas Louie
Yes.
at Calgary Foothills Hospital, I was one of the first people that had a fecal transplant. A poop transplant's not sexy, people,
No,
but
it's
it
not.
saved my life.
It does.
I have a blog on that too, if you want to read it.
So when your clients
But the
take it-
difference in my mental health
Is-
almost instantly
Instantly.
was significant. And so this is not voodoo stuff.
No,
This
it's
is
not.
real
No.
science.
That's
so when
right.
your clients or your viewers have antibiotics, the doctor is supposed to recommend probiotics and prebiotics with it, because the antibiotics is antibiotics. It kills the good bacteria and the bad bacteria. So you don't want the good bacteria to be killed. So you have to take those along with that.
Right.
Particularly if you have high blood pressure. I'll tell you why. I get clients, when they actually take the Altase and Norvasc and hydrochlorothiazide and all of the beta blockers, amlodipine and all of the other stuff in the pharmacopoeia,
Yeah.
and they still have high blood pressure, look for the white coat syndrome. Log your blood pressure at home when you're lying down and doing the belly breath. Now, I have challenged somebody to do 10 belly breath. Their blood pressure is reduced by 10%. And I do not wear I have a white lab coat, but I don't wear it when I do this. And I do it, measure it supine. I have so many clients in the thousands to reduce their medication with their own physician by measuring their own blood pressure. And I told them it's 130/90. You can work with your physician to cut it by skip 1 day or skip 2 days, and if it's still the same, skip 3 days. So there is no need to worry about that because this is just controlling the systolic and the diastolic, but you have to look also at the number, which is the heart rate, which is so important. So the resting heart rate is actually as important as systolic and diastolic. But all of these can be controlled with breathing, exercise, walking 3 times per week, 45 minutes, simple things. And the belly breathing is so simple to do.
Yeah, it is.
It's abdominal breathing that reduces your blood pressure. It is actually more effective than taking antihypertensive. And now some of the drug companies, they're gonna not like me saying this, but do the research and show me if it works.
I agree.
Evidence.
I suffer from white coat.
Yes.
And that's
When-
why they take 10
yes.
readings. We're going to leave you in a dark room for 10 minutes.
Yeah.
We'll take 10 readings
Yeah.
and we'll come back.
But if you have it at home and it's 130/90, and if you go to the doctor and 160/200, then it's not you, it's a white coat. And it's
Situational.
been documented.
Yeah.
It's
Yes.
iatrogenic, it's documented in the JAMA and also in the CMA, okay? Canadian Medical
Yes.
Association.
All right, we have more to cover
Yes.
but we are going to take a break here in a minute.
Sure.
So we look forward to coming back and
Sure.
giving more practical tips on
Sure.
how to help you
Sure.
live to 101. We're not going to give you 101 ways because we don't have time today, but we're going to come back with a few more tips. Stay with us. We'll be right back here at Let's Just Do This.
Welcome back to Let's Just Do This. I'm Todd Miller along with Margaret Wallis-Duffy, and we are having an amazing conversation with Dr. Grant and Denise Roy about just wellness.
Yes.
Simple things that can be done by everyone to feel better.
Yes.
Integratively and preventatively, how novel is that? Right? It's simple, but wouldn't we all feel better if we actually invested enough in our own health with some of the tools that you're talking about? So we don't have a lot of time left, so we need to jump in and really start to pick this gentleman's brain about some tips. What are we going to talk about next, Todd?
Something that has touched my life and many people's life, mental health.
Yes.
We are in such a state of crisis right now with mental health for a variety of reasons. And although pharmaceuticals come into play, I believe there's probably more we can do for people that are touched by various parts of mental health to take care of ourselves and
Right.
get well.
Right, right. What we hear in the news, last weekend, about this explosion here and there, and the person hitting this, hitting that, it's all about mental health. It's all about imbalance in brain neurotransmitters. It's all about improper eating habits, drinking habits, sleeping habits. If your body is in imbalance, that is not in the state of wellness, it's a state of illness. So there's a series on the internet going right now called Broken Brains. I'm not sure whether you heard about it or not.
No.
You should actually Google it and look for it from a very famous doctor from Cleveland Clinic. And he's talking about broken brains and how we have this increased mental health challenges. And I happen to be a friend of his, and he's very well known. So I'll let you look at this series, and all we need to do here is to oxygenate the brain. It's simple, belly breathing, drinking the water, because our body is 72% water.
Yeah.
So without hydration, without oxygenation, nothing else will work.
And many of us do not drink enough water.
And then most of us, they drink the wrong stuff, 3 or 4 coffee, double, and they drink the soda, and then the Dr. Pepper and all of the stuff. I'm not gonna even go there. So all of the stuff affect the brain, affect neurotransmitters, and neurotransmitters is how our brain communicate. This is the basis for Parkinson's, and we have dealt with so many clients with Parkinson's, they stop the shaking after the first or second session because we fix their C1, C2, and then we actually tell them to eat the proper food, and they start to eat the vegetables, and they start to actually eat the 2 fruits, and they start to do the belly breathing, and their symptom for blood pressure, for diabetes, for memory impairment is totally reversed. So we can actually reverse all of this brain stuff. All of this stuff, depression can be reversed without needing to do the SSRI. Nobody needs really the Prozac or the Xanax or all of this stuff. But if you're on those medication, just for your education, read the side effect, read the risk. And if the risk ever exceeds the benefits, I mean, your viewers are very, very smart enough to understand that.
Yes,
If there
indeed.
is to the benefit, you should not do that and then find the alternative.
But consult a medical professional first
Consult a
before
medical
you...
professional.
Absolutely.
Because there's things like we use in our practice in integrative medicine that is so easy. It is so, like griffonia seed, like St. John's wort, which actually it helped with the serotonin.
Vitamin D3
Vitamin
is
D3,
very
and
important for us
unfortunately,
here.
doctors recommend only 600 IU, which is not enough. I recommend 5,000. I take 10,000 IU myself. It's
10,000
safe.
daily.
10,000. And I'm a toxicologist. We have not seen one single documented case in toxicology about somebody dying from 50,000 units IU a day. We have not seen one yet. I'm not asking for 50,000. I'm only asking between 5 and 10. It's safe, very safe to take.
And I'm gonna interject and be controversial, but you know what? I'm gonna say it. But we're okay with having issues with side effects, and they're still on the market.
Yes.
We poo-poo having high doses like
Yes.
that, and there's no documented cases.
Absolutely not.
But we're okay with not only having serious side effects, but having people die
yes.
from
Yes.
side effects of
Oh,
medications. And that particular norm, that level, we're okay with. We're okay with that. And I know Health Canada has numbers that they'll say
Yes.
this is within the normal range.
Yeah.
But then we're frightened about giving vitamins because we might become toxic.
I know it's insane. As a scientist with 3 doctorate degrees, if we have enough death from people taking medications right now, if the same death happened in any airport, the FAA will stop flying.
Right.
Yeah.
If you have 1,000, crashes, and seriously, when we have to look at this very seriously, because if the risk exceeds the benefit, have people dying from side effects of medication, let's just try to prevent people from dying from medication. I am passionate about this. I'm a toxicologist.
Yes.
I've published so many papers on this, and I challenge anybody who can tell you that 10,000 IU would harm somebody, or 5,000 IU. So, vitamin D for diabetes, for dementia and depression. Vitamin D, along with other autoimmune disease, along with other things. So, vitamin D and like D3 and K2 are so important for diabetes, dementia, depression, and blood pressure,
Right.
and any autoimmune disease like fibromyalgia, MS, lupus, Lyme disease. All of these are important if you take the D3 and K2 at recommended dosage.
And what's your diet, obviously, because there's the connection that
Exactly.
you mentioned earlier
Sunshine.
between the gut,
Between the gut
and the brain.
and the brain health,
Exactly.
right?
Very important.
Because when I was suffering of IBS, I was actually depressed, and I didn't realize that.
Yes,
Right.
exactly.
Right.
Exactly.
Right. So I can relate to your story.
We have one more topic. Do we have time?
Yes, we do.
Go ahead.
Fertility.
Yes.
So many couples, like
Yes.
myself
Yes.
and my partner, struggle
Yes.
to get pregnant and
Yes.
have struggled.
Fertility, Todd, is toxicity. We have toxic we live in a toxic soup, like the water we drink and the air we breathe. And all of the stuff in even the water, the fluoride and the chlorine and all of the stuff, the pesticides now in our vegetables, in our fruits, it cause infertility for men and women. So I worked in a fertility clinic in North York for 5 years, and I found that men now, they have problem with low sperm count.
Yep.
And I have women with problem with ovulation, and they cannot get pregnant because, first of all, they have some problem on their own because of exposure to so many chemicals on their own. And then we're exposed to anything in with X in our household, like Talax, Clorox, Javax, Windex. This can cause fertility problems, and we use this. Like if you wash your underwear with chlorine bleach, and you ask me about why fertility is in the rise, I'm a toxicologist. And if somebody with asthma and exposed to chlorine bleach, this is #1 asthma trigger. What's the point of taking all of the Ventolin and corticosteroids and the Pulmicort, and then they expose...
Go clean your windows.
Okay, clean your window with Windex, and they swim in a pool that has chlorine bleach, and they say, I'm having asthma. Yes, you're gonna have asthma because you're exposed to... Let's find the cause first, instead of trying to mask and put a Band-Aid on the symptom. It is so
man.
simple, really. I mean, you have to be also a pharmacologist and toxicologist in the same hat, and then you have to be in integrative medicine to understand, because we have so many clients who do not need any medication for asthma or any medication. We have worked with a couple with fertility, and now, without IVF, without any invasive stuff,
Really?
there is no need to spend $30,000 for IVF. Come and see us at our clinic in North York. The number is 1111 Finch, and the suite is 401. And if you have difficult remembering this. You should come and see me for memory problems.
Well, there's EMF also. We're
And EMF
exposed
expo-
because
cell
we
phone,
have so many
computers.
cell phones,
Exactly.
cell phone towers, computers.
Exactly.
You know, the
Exactly.
technology
Yes.
around us is actually affecting our health too. So, you know, I personally, I forget because I'm so used to it. I sleep with my phone next to me.
never do that.
And see,
Never do
he's not happy about that. And we can actually measure, you know, how much exposure you've been
Yes.
through, you know, and things like that. And it's amazing to see young men that are 23, 24, 25 with low sperm count. It's shocking. They're at their peak.
Not only low sperm count, Denise, but low desire.
Low
How
desire
can somebody
too.
mid-25 taking Viagra and Cialis? Like, I actually told one of my clients, you're going to end up with heart attack. You know what he told me? Doc, at least I die happy. I said, this is not a happy. That's when you have sex and you have a heart attack with Viagra. And well, this is one of the side effects, by the way. I'm not just making this up. You look at the risk and
Absolutely.
benefit. So, like, seriously, there's so many things that you can take. Tribulus, you can take Demiana, you can take horny goat weed. There's so many other bush medicine.
He actually has his own little potion that he
formula.
makes.
Yes.
We're not going to give you the recipe, sorry.
It's so refreshing to find a physician that has a 360-degree
Vision.
view of
Yes.
wellness and healthcare.
Yes.
Well, I just want to say he's not officially a physician.
No,
I just want to make
I-
that
I am
clear
an
so we
IMD,
do not.
integrative, yeah.
He's an integrative
I do not
medical
do
doctor and he has a
medications.
PhD
Yes.
also in.
That's right. Correct.
Thank
Yeah.
you for clarifying,
Yes,
because
in
that's very, very
psychology,
important.
yeah.
Yes. You know, one of the things that jumped out when you were talking so passionately there about the way we live our lives and the choices that we make.
Yes.
What I love, and because often it can be overwhelming, I see this in my clinic every day. Where do you start? Where do you start to reverse things?
Baby steps.
Exactly. So when you talked about Windex, I haven't used Windex in my house for a very long time.
Amazing.
You know, and thanks to my mother, I'm giving you a shout out, Mom, because my mom's incredible and has taught me so much. And one of my passions for integrative health oft has come from the way my mom lived doing yoga and belly breathing and things before it was cool to do that, right?
Yes.
But things like, you know, making your own with vinegar and
baking soda.
and
Essential
essential
oil.
oils. And
Exactly.
Exactly.
Actually, did you know
and
that
it does the
there's
job.
a paper published just last month to show that women who are using those cleaning products every day, equivalent to having one pack of cigarettes every single day. Wow. This is, you searched in Google, evidence-based for 30 years.
Yes.
So if any woman using any of those toxic stuff, after watching us now on this segment, they should stop using those toxic products. Seriously.
Yes, and then why I wanted to bring that up
Yes.
is that people need to be able to start somewhere.
exactly.
And that's one, we talked about drinking water. I always say, the very beginning, take your body weight, divide it in half. That's the bare minimum of water you should have in a day
2 to 3
at
liters.
rest.
Yes,
at
at
rest.
rest. Exactly.
When you're stressed, when you've exercised, you're going to need to up that water. These little steps seem so insignificant because we live in a world where we've complicated things so much,
And I work
but
with
we don't
Olympic
do
athletes, Margaret. 10
Yes.
in Canada and 10 in the US, minimum 3 liters per day. They have to have that because they put their body under extensive
Stress.
stress and physical stress. So if they're not hydrated,
Right.
if they're not fully oxygenated, I said, I'm not going to work with you anymore. Okay, doc, I'll do my 3 liters.
You know, it's funny you're going to say this, and this patient of mine, I'm not going to give the name, but
Yes.
a young, wonderful guy who's is a aspiring track and field superstar. Young guy, he's, I don't know, 16, 17 years old.
wonderful, yeah.
Put my hands as a therapist on him this week and instantly know he's dehydrated. No, it's not his skin that I'm feeling. It's not the dryness. His tissue is dehydrated.
yeah.
And he was running in a major event the next day, a major meet. And I said to him, you don't drink water.
Exactly.
His mother was in the waiting room, and when I spoke to her and said she needs to drink water, her eyes were like, I keep telling him this. I can't wait to hear how this gentleman did, this young man did,
And we measure
because
this
it's
in
so
our
important.
biofeedback testing, by the way. So we
Yes.
can tell you how much water you're not drinking right now and how much more you should supposed to be drinking. Because
Right.
water and oxygen, like H2 and O2, what else do we need more than that, really?
It's so critical.
And if you want to test somebody if they are dehydrated, you just press this area right there, and if it bounces back, that means they're hydrated. If it's still like have a
Indentation?
that means they need some more water.
Right.
So
Todd's
Todd is
checking.
concerned. Todd is concerned,
I don't
everybody.
want to look.
You know what? What I love about our discussions is I can feel your passion, and I know the listeners and viewers, it will be oozing through their screens.
Thank you.
Because it's clear. I also love that you actually care
I
about
do.
the people
I
that
do
you're
a lot.
treating.
I do.
You do. And I love that you're bringing the science behind it. This is not voodoo medicine.
It is not.
And I just am so honored to be able to not only have you on our show, but to be able to link arms with you on this Better Together mission so that we can actually leave a legacy behind for our children and grandchildren of a different system. If we shift that needle just a little bit, where people are thinking differently about their health, I think this podcast was a step in the right direction for that. So
I have to be my honor to invite you and Todd and Denise to come to my lecture next Wednesday, May 30th at 7 p.m. Fairview Theatre in Toronto. If the viewers are in Toronto, come, no cost, to be also coming to this lecture for the Ontario Dental Assistant Association.
Okay.
And then I'm going to introduce you as one of my VIP, and you talk about everything we discussed here.
Wonderful.
Because I'm going to have a whole hour, not just 15 minutes, and I'll be speaking a bit slower.
We need to
Yes,
have you
indeed.
back. That's what we're doing.
Yes.
Well, we're going to be back. So thank you so much, both of
Thank
you,
you,
for
Margaret.
coming. And as you can tell, we are on a mission here at Let's Just Do This. We're going to be better together. That means conventional, complementary medicine, the patient, government, insurance companies, all of us need to link arms and work together so we can improve our well-being. On behalf of myself, Todd Miller, and our entire team here at Your TV and Let's Just Do This, thank you so much for tuning in. We want to hear from you. Stay connected. That really matters to us. And until next time, be well. Oh, and drink your water.
Cheers.
Thank you.